Greetings. In this video, I'm going to discuss the danger signs of pregnancy. The meaning of danger signs of pregnancy simply means when you notice you are having these symptoms, it's an emergency, and what you need to do is to head to the hospital so that you see a doctor to help intervene in this emergency. You understand what I mean? So when you hear they say danger signs of pregnancy, it means signs that you have or symptoms that you have during pregnancy that is an emergency that you don't just need to sit at home and try to treat. You must go to the hospital for it to be treated. Now, one of the danger signs of pregnancy is vaginal bleeding. Anytime you notice that you are having vaginal bleeding, it's a warning sign, it's a danger, it's telling you there is danger and you need to go to the hospital. That vaginal bleeding may be because you are having a miscarriage or you have an ectopic pregnancy. You understand? So when you see vaginal bleeding during pregnancy, when you are bleeding from the vagina during pregnancy, it may be because you are about to have a miscarriage or you have already had a miscarriage, or it is the one we call threatened abortion. You're about to lose your baby. And another thing is that you have ectopic pregnancy. These two conditions are emergencies and you need to rush to the hospital. Another danger sign you may have during pregnancy is that you may be seeing water, especially for the last trimester, in the third trimester, third or second trimester. You may start seeing water. You are leaking water through the vagina. Yes, it means that the amniotic sac has ruptured and it is an emergency, especially when it's not time for you to deliver. It's an emergency. If you are having persistent headache, number 3 danger sign now. If you are having persistent headache in pregnancy, persistent headache that is never going away, frontal headache, especially headache in the front of your head, this way. You're having persistent headache, you are not able to sleep, every day you are having headache, it's a danger sign. It may just be a sign that your blood pressure is elevated. You have preeclampsia in pregnancy. You understand? So you need to rush to the hospital as soon as possible so that you can be started on your BP can be checked and you can be started on medications. You understand? Then if you suffer any seizure, any pregnant woman that have had a seizure, that had a seizure, when I mean seizure, convulsion, you are pregnant and you had a convulsion, it's a danger sign. That is eclampsia. That's the one they call eclampsia. Preeclampsia is elevated blood pressure. It becomes eclampsia when you have a seizure, when you have a convulsion. You understand? Some women may not even notice that their blood pressure is high, but the first danger sign they will see is that they will have a convulsion, and that is an emergency. You need to go to the hospital. You understand? By danger sign of pregnancy is that this symptom and sign actually pose not just a risk to you, they also pose a risk to the baby. Do you understand? They pose a risk to you and to the baby. You may lose your life from this warning, from the danger sign, or your baby may lose his or her life. Your born baby may lose his or her life. That is why you need to rush to the hospital. So that is in combination. I've added this definition to the one I gave before, where I said danger sign of pregnancy is an emergency that you need to see a doctor for immediately. Yes, it's an emergency that poses risk to both you and your baby. And you need to see a doctor immediately for it to be sorted out. Now, if you have, I've mentioned vaginal bleeding and mentioned leakage of water from the vagina as danger sign, headaches, seizures, they are danger sign. If you are feeling dizzy, you are pregnant and you're always feeling dizzy, you also need to go to the hospital. It may be that your blood pressure is low. You understand? Go to the hospital. If you are having fever in pregnancy, your body is hot, it's not good, or you may have a miscarriage from that. Elevated temperature is not good to you and even to the baby. When your temperature is very high, it may make you lose your baby. You may have a miscarriage from elevated temperature, so you need to go to the hospital. This elevated temperature may be from either you have pneumonia, you have malaria, depending on your location, or you have a urinary tract infection or a vaginal infection. Now, when you have foul smelling vaginal discharge, it's also a danger sign. You're having vaginal discharge that is foul smelling is danger sign because it may make you have a miscarriage, it may make you develop fever, it may also affect your baby. And during delivery, it will affect your baby. Have you seen some children that were born with infection of the eye because their mother had gonorrhea? And most time when they were pregnant, they will be having discharge, they will take it as nothing. So that is another danger sign. I mentioned dizziness. When you are also dizzy, when you are feeling dizzy, feeling like fainting in pregnancy, or you actually fainted, apart from you having low blood pressure, it may also be that you don't have enough blood in your body. Anemia, you have anemia. That is a danger sign in pregnancy. I've mentioned quite some numbers. Another thing you should know, yes, if you are having contraction, it's not yet time for you to deliver, but you are having contraction. You start having contraction. You are about to lose your pregnancy. That is what it means. And it's a danger sign. You need to go to the hospital as soon as possible. Not as soon as, immediately, so that you can get sorted out. You're having contraction, you are not 37 weeks yet. You are 34 weeks, you are 30 weeks, you are 28 weeks, you are having contraction that sounds like labor. Go to the hospital. That's a danger sign. If you're having abdominal pain, you're having abdominal pain during pregnancy, it's also a danger sign of pregnancy. It's a danger sign of pregnancy. You understand? That abdominal pain may be because you're about to lose that baby. You may have appendix. Yes, there are some women that have appendix in pregnancy. Oh. They have appendix, they have appendicitis in pregnancy. It may be because of UTI or because you have a pelvic inflammatory disease or vaginal discharge. So you need to go to the hospital to see a doctor. If you are always vomiting, have you heard of what they call hyperemesis gravidarum? You are always vomiting in pregnancy. You are vomiting every day. You vomit like 2 to 3 times a day. Madam, please rush to the hospital. It's a danger sign. You know why? You vomit so much that you become dehydrated. And once you become dehydrated, anything can happen. It may shut down your kidneys. So you need to go to the hospital to see a doctor. It's a danger sign. Vomiting excessively in pregnancy is not good. Yes, you may have nausea, but when you start vomiting, sometimes some women vomit 5 times a day. It's not good. They become very weak because of the vomiting. They vomit and vomit and vomit. They vomit almost everything out of their body or out of their intestine. They become very weak. Another thing is that you are pregnant and you notice that your hands are paining you. And your hands are paining, your hands are swollen. It's a danger sign. Your feet are swollen. You have swollen legs. It's also a danger sign. Yes, I've explained that some women they notice that their legs become swollen as the pregnancy progresses because the baby is pressing on the veins that will take blood fluid, the water back to the heart. Yes, but there are some cases where in elevated blood pressure, the legs will be swollen. So you need to see a doctor. If you also notice that you are pregnant and your face is swollen, go and see a doctor. It's a danger sign because that may be a pointer that your kidneys are failing. You understand? I don't know if I've missed any other danger sign. I've mentioned temperature. Yes, if you are losing your sight, you are pregnant, you notice that you are no longer seeing well. You are no longer, your vision is now becoming blurred. That may be a sign that you are losing. That's a danger sign. And that is pointing to elevated blood pressure. Preeclampsia in pregnancy is a danger sign. You cannot become blind because you are pregnant. You understand? It's a danger sign. Please, I don't want to go beyond 10 minutes in this video, and I'm already at 9 minutes. I will continue. If you have any question, put it in the comment section. Please, I'm begging you to also use the link in my bio, my YouTube link in my bio, to subscribe to my YouTube channel. If you have any question concerning danger sign, I may not have mentioned everything. Of course, I may not have mentioned everything. But if you have any sign you notice, you want to confirm whether it's bad, it's a danger sign, put it in the comment section. I will respond to you immediately. Thank you, and thank you for your support so far. Bye-bye.